I think there's a pretty big vote coming up, isn't there?
Well, there is. Much of the talk today has been about when that vote will occur. It's certainly the focus of Washington, D.C., and perhaps the country. We had tens of thousands of Americans here yesterday interested in the topic, and it's been an ongoing conversation in Congress now for a long time. And the question is, when will that vote occur? And, of course, the leadership of the House, the Democrat leadership of the House is saying tomorrow, perhaps at around 6 p.m. The goal, and in fact we've insisted upon this, that there be a waiting period of 76 hours, 72 hours to allow the American people, members of Congress, to try to digest this legislation, nearly 2,000 pages. The question now is, do the Democrat leaders have the vote to pass this bill? There will be no Republican, it would be my best guess, who will vote for this legislation. And I don't say that in a partisan way. I absolutely believe this is bad legislation. It's not the direction we want to go. There are lots of opportunities to improve health care, but not this bill. And so if this bill is going to pass, it's going to take 218 Democrat votes. And today, certainly the rumors, the conversation around Washington, D.C. is that they're not at 218. In fact, the guess is that they're way short of having the necessary votes to pass the bill. So
what don't you like about this specific bill?
Well, a lot that I don't like about this bill. And from a Kansas perspective, which is one of the most important to me, it is just a bad idea to take money out of Medicare, a system that is going broke, and use that money to pay for health care for more people. In Kansas, we struggle to keep hospital doors open, to keep physicians in communities, and if we reduce the ability for Medicare to pay for health care services for those that Medicare is already to take care of, our senior citizens, what that means is that we'll have less access to health care in Kansas. Only in Washington can you take money out of a trust fund, the Medicare trust fund that's going bankrupt, and say, let's spend some more money someplace else. And that's a bad fiscal issue. It's the wrong thing to do financially, but very specific back to home. I chair the Rural Healthcare Coalition, 150 plus members of Congress, Republicans and Democrats, who try to make certain that rural America doesn't get left out in this debate. And in my opinion, this bill is very damaging to the opportunity for Kansans to continue to access health care at their hospital, with their doctor, home health care, nursing home care across our state, and would be a terrible outcome for a rural place like home.
And there's a separate Republican bill making its way through as well, right?
Well, there is. There's a Republican proposal. One of the unfortunate things about the debate that's to occur on this bill is that no amendments are apparently going to be made in order, which means none of us have the opportunity to go to the House floor and say, well, what about this? Let me try to change this in this way. The only opportunity for something different than what the Democrat plan is the Republicans will be allowed to offer an alternative at the end of the debate. And again, I think there's many things we can do. Some of them are contained in the Republican plan. I have a Moran plan that I've explained to Kansans, have written opinion pieces for newspapers, and have talked about this at town hall meetings across our state. I'm not one of those at all who says, let's do nothing. I'm one who says there are some real things we can do to reduce the ever-escalating cost of health care. And that's what I wish we were doing here, instead of creating some huge government program, particularly out of money that currently is there for Kansans to access health care.
Just off topic real quick, I know that there was a big, I think it was labeled as a Republican news conference yesterday that kind of turned into more of a rally-like atmosphere with thousands of people there. Tell me about that. What do you think about that?
I was there. The amazing thing to me about this topic is clearly one that Americans care about, and I would suggest that there are people on both sides of this issue. I mean, as most times there are. But the request for Americans to come to Washington, D.C. 6 days ago was made, and tens of thousands of Americans show in Washington, D.C. to make sure their members of Congress know of their opposition to this health care plan. And it seems to me that this health care issue is just something that really is, it's symbolic of what Americans see going on in Washington, D.C. It's not just about health care. A lot of what I think Americans feel, particularly Kansans, I know how they feel. They have great concern about the amount of spending, the borrowing, the deficit that we're creating, and the health care bill adds to that. But it's just one component in a reason that many Kansans are concerned with what's happening in the nation's capital. and it's all the stimulus packages, the bailouts, it's cap and trade, it's cash for clunkers. It's a question that many Americans have, kind of, oh my gosh, what is going on in Washington, D.C., and how do we afford this? And I'm one who believes that we have a responsibility to our children and grandchildren, another generation of Americans, to make sure that we don't do things that diminish their opportunities for freedom, and their chance to live long and productive lives. And I worry that all the spending, borrowing, and apparently many Americans share that concern, that spending and borrowing is doing something that means we're very selfish today, spending money today that we expect our kids and grandkids to pay in the future.